September is Baby Safety Month, a good time for first-time parents, parents of growing families with big brothers and sisters, as well as the grandparents, to review important information to keep their children safe and healthy. For today's To Your Wellbeing, we are joined by Cone Health pediatrician Dr. Boylston. Let's start with baby-proofing your home, Dr. Boylston. So there are obvious places, right, that you're going to baby-proof. You're going to do those electrical sockets, and you're going to make sure that any kind of cord or whatever is up. But what are some of the maybe not so obvious things that parents and grandparents, aunts and uncles maybe too, that are going to be watching kids that they need to look out for?
That's a great question, Tanya. Families tend to be very good about baby-proofing fixtures like the cords, sharp corners. But one thing that often is overlooked would be everyday items that can potentially be a choking hazard. These include things like detergent pods, in the laundry room, maybe certain medicines or other things that might be kept out in the open, Legos or other small little objects that older children may have, as well as something that seems really innocent like a remote control, which can have button batteries that are certainly a risk for small infants and toddlers.
Because the first thing they want to do is put them in their mouth, of course, right? And all you need is that back hatch that's a little loose, and then there's the batteries, and down they go. Okay, what is the best way to identify where to baby-proof? Because I think sometimes you look around the house and you're like, I got this, and then you're like, ooh, I probably should take a few more steps, but I don't even know where to begin.
Yes. First, it would be a great idea to, one, not get overwhelmed and kind of get in the position where the child or infant is going to experience the room. And so typically that's on the ground in kind of crawler mode, if you do have a mover, and kind of look at what might cause trouble. What looks really tempting and colorful, what might they pull down on, and what else might fall down because of that. And the other thing that I think helps parents is the baby doesn't need free reign over your entire house. It might be just their bedroom and a good part of the living room. And so really focus on those areas. Areas like your laundry room, your kitchen, or the bathroom, the baby really does require close supervision. And so they should be monitored at all times in those environments.
Okay. So for parents who already have kids and they think, oh, I've got this because I've been down this road before, it is not my first rodeo, what kind of advice do you have?
Yeah, I think that tends to be when parents get a little complacent, and sometimes it's actually those situations that tend to lead to trouble. I think it's always a good idea to approach each infant or child with a fresh set of eyes. Their temperament may be different. That child may get into things that maybe older children didn't. And also recommendations can change within the years between children. And so there certainly are product recalls or things that families may have used with older children that really may not be recommended at this time. And so staying up to date is really important.
All right, let's talk about that, the staying up to date, because we're going to talk about sleeping, the do's and don'ts. And you've got parents and grandparents who said, well, this is the way I put you to sleep. Why can't I put the baby to sleep this way? So what are the do's and don'ts?
Right. And, that can be a kind of a fine line for families because clearly we all made it. But I always say we know a little bit better now, and it's really to minimize risk. And so the current recommendations are for all infants under 12 months is to always put them on their back to sleep in their own space. And for several reasons. So one would be, we certainly want to reduce SIDS risk, which is sudden infant death syndrome. We want to avoid any sort of suffocation during sleep. And we also want to promote really good uninterrupted sleep patterns. And so being in their own space, on their back. And then within that bassinet or crib environment, it's really important to avoid any plush objects like pillows, bumpers, plush blankets, or stuffed animals. It really should be a really Spartan environment with just a thin blanket and a firm mattress. That's what's best at this time.
And of course, that's not how they sell the baby set of sheets and the way that they set up the room, right, in the decor. Right. But that is what needs to happen. Okay. It's still hot outside today. I know we're going to get a little burst of fall weather, but there are still reports of babies and children being left in cars. So can we talk about some recommendations and some things you want parents to know?
Absolutely. And, when we hear about that, that's such a tragic event. And certainly we want to do everything we can to to reduce that risk. And for parents who are on the go, this is a really frenzied time. Parents are often distracted and have a lot on their minds. But I think that if you just come up with a mental tool that, kids and keys. So it might be something as simply as I take the keys out, and you always want to check, especially if you have an infant carrier in the car. I think just a little spot check that you kind of hardwire into your car routine can be really helpful and prevent those lapses in attention.
All right, and so there's advice for people without kids even related to hot cars.
Oh, sure, of course. And for parents and as well as anyone who might care for children or have children in their environment, good habits are to just lock the car when it's not in use. And that's to prevent just good habits to prevent theft. But also, if you have children playing outside, they might get into the cars, they may accidentally lock themselves in. And so we really want to avoid those preventable situations.
COVID-19, it's resurging in our community. So how can we protect little ones, babies, young children, those that at this point still cannot be vaccinated as of yet?
Great question, Tanya. Really, the best way to protect small children and those who are not eligible to be vaccinated is to create a cocoon. And by that, it's to have everyone around those children who are eligible to be fully vaccinated. And even when you're not around the child, to practice safe habits, such as wearing a mask in public and also washing hands diligently. And that way, it really reduces the overall exposure for those children and infants.
I know this question has come up quite often, but we learn more and more every time that we ask it because new things are learned as well. So what are the benefits, the antibodies from the vaccine? Are they able to be passed to the babies from breastfeeding moms?
Yeah, this is such a bonus because when you think about what vaccines do, this is the one way that one shot can actually protect two people directly. And so studies have shown that vaccinated breastfeeding moms do have protective COVID-19 antibodies in their breast milk. And we know this to be true for several other vaccine preventable illnesses, such as whooping cough and flu. And that's why those are encouraged during pregnancy to really help not just the mom, but also the baby.
All right. So this is the thing, right? You bring home the newborn baby and everybody wants to see the baby and you want to show off the baby. So is it okay to have friends and family members over if they are not vaccinated?
This can be a very challenging but important and necessary discussion. I think for all families, you really want to talk to each other about the risks. And right now, with the high prevalence of COVID, that exposing your infant and your family unit to unvaccinated individuals, it certainly does entail risk, and it really is about what you're comfortable with. And it's important to know that everyone has the best of intentions, but sometimes you can actually be contagious and not have significant symptoms at that time. So always, being mindful that there is a potential you may have it, certainly if you're unvaccinated. And I think that it's really important that we support families so that they don't feel socially pressured to do anything that they feel is unsafe for their baby or that may put them in harm's way.
Mm-hmm. And what about play dates with other little ones and their parents? Are there some do's and don'ts that you think that we should talk about regarding COVID?
Absolutely. We really want children to thrive, and we know that a big part of that is social development. So it's learning how to play with one another, but there are definitely safe ways to do it in this current time. And so, some of the best practices might be keeping the play group small, choosing an outdoor setting, making sure that children are washing their hands, and also you take your own snacks. You don't share common drinks or other foods. And for the children who are younger, especially under 3, that they stick to their own toys, especially those that are really prone to put things in their mouth.
Mm-hmm. All right. And then the other thing I always think of is, people, when they see kids, they always want to touch their face and, squeeze their nose and it's kind of like, hey, how about you just touch their feet?
That's a great way. That's a great suggestion because it really helps people still engage and yet they do it in a safe way.